Now we will have a presentation from an international guest. Flying from Switzerland to Tromsø yesterday, and even you got the opportunity to see the Northern Lights. I have the honor of welcoming Professor Kerstin Denneke. Denneke is a computer scientist and PhD from the Bern University of Applied Sciences. She's also the chair of the IMIA, Participatory Health and Social Media Working Group. So we look forward to your presentation, Professor Denneke.
Thank you for the introduction. So my topic is sentiment analysis from social media. I will not really present research results from my own, but I decided to give you an overview on sentiment analysis, on the topic of sentiment analysis applied to social media. So I will start with defining medical opinion. What is a medical opinion? It comprises actually 4 aspects. It has a sentiment target, which is when we consider the sentence, the tumor is malignant, then the sentiment target is the tumor, or on a more higher level, the patient has a tumor. Then we have an opinion holder, so the person who is saying this, the tumor is malignant. So this can be in a social media post. The patient can write, my tumor is malignant, but he can also use indirect speech. The physician said the tumor is malignant. So then the opinion holder would be the physician, and in the first case, the opinion holder would be the patient. Then there is a medical sentiment, which can be rational or emotional. So staying with this example of the sentence, the tumor is malignant, this would be a rational sentiment. So it's rather objective, but still it's bad. So malignant is something bad. In particular, considering the patient, it has some negative impact on the health of the patient. But there are also emotional medical sentiments when the patient is writing, for example, it hurts terribly or whatever. And each medical opinion has a specific time, a timestamp. So that can be a timestamp of the finding report or the timestamp of the social media post or whatever. So spending a few more words about the sentiment targets. As I mentioned before, the tumor or the patient could be the target of expressing a sentiment, but they are different targets. And for example, we can consider disease-specific risk factors, like whether something is present or not. So for the different diseases, we have risk factors, which might be some symptoms, but also like smoking or having increased blood pressure, something like this. These are disease-specific risk factors, and we can express more or less rational sentiment about them, whether they exist or not, or whether they're good or bad. Then another sentiment target might be the treatment. So the treatment, there we can make statements about the efficacy, about the outcome, whether the outcome was good or not. And also about the treatment, we can find information about the compliance, in particular also in the social media data. Then other sentiment targets concern diseases or symptoms, which might be present, for example, and just consider clinical narratives, where some physician is writing some specific anatomical structure is present or not, or some symptom is certain, some disease is certain, and so on. And there are also some less related to the human body, but to healthcare in general, sentiment targets concerning the healthcare services. And here we can find a lot of information in social media where people are reflecting or expressing their emotions about their satisfaction with healthcare service providers or with the healthcare system in general. So as I mentioned, the topic of my talk is sentiment analysis from social media. So we heard already 2 presentations about social media. And also sentiment analysis can be applied to these different medical social media sources. So here I consider social media, medical social media, having in mind that people are describing something related to their disease or to the healthcare system. So there are social networking sites like Facebook and Twitter, media sharing sites like YouTube and Instagram, content production systems like blogs, microblogs, or user reviews, which are interesting also in terms of sentiment analysis. Their discussions forums, or I included also chatbots, where dialogue systems where we communicate with a system, and these chatbots try sometimes to analyze our opinions, our sentiments, to make other recommendations or to learn more about our behavior. So given these different sources of information in social media, considering these different channels where text is posted, they come along different linguistic characteristics. So when considering Twitter, for example, we have very short statements. In contrast, when we consider blog postings, we might have very long sentences. So this is something we have to keep in mind when we are applying sentiment analysis methods. Then there might be abbreviations and misspellings from a linguistic point of view. So in Twitter, because of the restricted length of messages, we probably are more used to use abbreviation and misspellings because we are writing these things well on the way to work or whatever. So we are not concentrating too much on how to write things properly. Then in contrast to clinical language and social media, of course, people are using common language, but they might contain domain-specific terms like medical symptoms, clinical terminology, or some specific terms that are only used in the medical domain. And irony and sarcasm is something we can find in social media as well. So in particular, when people are getting frustrated about their disease or their medical condition and their health conditions, then they are using irony and sarcasm to kind of deal with the situation. You can see on the slide also an example. So this is a drug review. You can see the comment. So it's a free textual comment written by the user. And in this platform here, the user is invited to select or to judge 3 categories: effectiveness, ease of use, and satisfaction. And they have these 5-star systems that you probably know from other websites as well. So this is a common review, and regarding sentiment analysis, we are basically interested in the free textual comment. So now I would like to show you a few use cases, just a few examples to give you an impression of what would be possible. So one use case I picked out is mental health, to use social media data and apply sentiment analysis onto them to do something to learn more about the mental health. So for example, to identify signals of depressions from social media. This would be a use case. There's also research on detecting suicidal ideation by applying sentiment analysis and emotion classification, and to learn more about development of diseases and preconditions. So what's the use case of sentiment analysis? So researchers can collect the social media data, apply sentiment analysis tools on this data, and then learn how people are expressing, what are they expressing regarding their suicidal ideation, for example, and to learn more about risk factors, for example. What are risk factors? When do people start committing suicide? We cannot help these people because it's not allowed actually to crawl also the identity of the users. So it's rather for research purposes that we can learn more about the medical conditions, about the behavior that is maybe good or bad for the medical condition and things like that. This is also related to mental health. It's a chatbot who supports the user in regulating emotions. That was actually a bachelor thesis I supervised. And this chatbot is asking some questions and the user is replying in a free textual manner. Then the chatbot in the background analyzes the user comments and runs an emotion analysis. So at the end, the chatbot knows or assumes some emotion that is expressed by the user and asks back, might it be that you are sad? And then when the user confirms, the chatbot suggests some activities, some exercises to change this emotion. So from being sad, maybe to be a bit more relaxed and not feeling so lost anymore. So this is also an application of sentiment analysis. Second group of use cases I chose is related to public health. We can also connect to the previous presentation. We learned in the previous presentation that social media can be good for running vaccination campaigns. And with applying sentiment analysis to social media posts, we can actually learn more about how people are, so what are their thoughts about the vaccination, what are their thoughts about some public health topic, like here in the example, it's about COVID-19 and the sentiment of people related to this pandemic. And of course, we can consider specific topics like vaccination or some political things, whatever we are interested in, and see what are the sentiments, the emotions expressed, what are the challenges, and what are something we would like to address in information campaigns like vaccination campaigns, for example. We can also use sentiment analysis applied to social media to monitor health behavior, so to learn more about what people are doing now in the situation of a pandemic, for example. The third use case I would like to present is related to pharmacovigilance. So pharmaceutical companies are interested or have to run post-market release surveillance. So they have to monitor their drugs and the adverse events of the drugs after putting them onto market. And one source that can be used here are drug reviews, the example I showed you at the beginning, but also forums, postings, and other social media data. So in these drug reviews, users explain or patients explain their experience, what kind of adverse events they experienced, and so on. And also we learn aspects related to the efficacy of the drugs. So by applying sentiment analysis to this kind of data sources like drug reviews, pharmaceutical companies can learn more about the drugs after putting them onto market. So this is another example. Here again, it's a comment from I showed you before. I just put it into one sentiment analysis tool that is available out there. So there are a lot of them. And I would like to point you to some things here. So we can, when you read the drug review, the first sentence is positive. The drug is absolutely helpful for chest pain. So this is what you can see in the sentence, in the list of sentences. The system recognized correctly that this is a positive sentence. The following 3 sentences are negatively classified by the system, and the last one is neutral. What you can see in the overall, so we can run sentiment analysis on sentence level. This is done here in the upper part of the slide. Then the system also presents a document sentiment, which says it is a negative document. And this is something that shows already the challenges we have in sentiment analysis. So when we read this review, we know from the first sentence, it's a positive statement about this drug. But when aggregating the sentiment of all these 5 sentences, then the system has to decide it's a negative posting. It's a negative opinion. And here, well, we still have to do some research on how to deal with these things. Maybe we have to weight the first sentence more than the other sentences or things like that. So the example I already showed, we have different options to run our sentiment analysis. We can consider the sentence level, so determine the sentiment of a sentence. We can even go more into more detail and consider aspects. So an aspect can be distributed around different sentences. So then we have to identify the aspects and have to associate the different parts to this aspect. So this is more complex, more challenging. And we can have a document level sentiment analysis, which tries to identify the sentiment of a whole document with the challenge of having misclassifications that we have seen in the previous example. In terms of the processing steps, there are always these 5 steps that have to be taken. So we, of course, first need data. So we have to, when you want to run an analysis, you have to choose the data. Is it Twitter? Is it some drug reviews? Whatever you want to get. So you need your data collection. Then the next step is data processing. So we have to analyze the text. There are tools available for this, to remove stop words, for example, or run some part of speech tagging, so to identify the word category, or do some lemmatization or morphological analysis of the terms. Then we can extract features. Here we, for example, can also identify named entities or clinical symptoms, terms related to the body and health of a patient, and use these as features in the final step of sentiment analysis. So we have to identify relevant features that might be useful for classifying the sentiment. There are lexicons available that help us to identify sentiment-bearing terms in a sentence. But this is challenging in the medical domain because we have different meanings of words. Maybe not so much difficult in medical social media, but when we are considering clinical narratives and apply sentiment analysis, then it becomes more difficult. So not to become too much technical, just the last slide about the methodology. So there are different types of methodologies. It's important to have this in mind when you're selecting your tool. So you can base your sentiment analysis on lexicons with the challenges I just mentioned. So there are a couple of sentiment analysis lexicons around there, but they are not specifically developed for the medical domain. There are 1 or 2, but this is important. And on the other side, we have machine learning technologies where we need training material to learn our sentiment classifier. So this is my last slide. What are my recommendations for the different groups? So when you're a developer, want to develop your own sentiment analysis techniques, and my recommendation is to use specialized lexicons when working in the medical domain. So as there's, for example, SentiHealth, focusing specifically on medical terms and sentiments in the medical domain. And it's always challenging to find the right feature set, and also to use some semantics in the medical domain. We have a lot of medical classification systems. Try out whether these can help in identifying the sentiment. And for users, when you don't want to develop your sentiment analysis algorithm on your own, my recommendation is to study at least the quality of the tool you're applying before using them. So run a few put some text in there, try out what happens, and then you have an impression what will happen to your data. And then also have in mind the level of analysis. Will it be a document level or a sentence level analysis? So this is the end of my presentation. If you're interested in more details about medical sentiment analysis, I will publish a book next year by Springer, and you can just send me a message and I will forward you the advertisement as soon as I have it. Thank you.